Hey there, do you want to easily and rapidly diagnose neck issues? If yes, stick around because in this episode, I've taken a short video clip from an event I recently taught, and by using this quick diagnosis technique, we can precisely target neural levels leading to drastic neck pain relief. My name is Dr. Jeremy, and I help acupuncturists like you create breakthrough patient results with the world's most cutting-edge electro-acupuncture techniques. Now, if you're not already subscribed, click the subscribe button. You can receive a notification each time I release a new training episode. I give away a free downloadable training resource along with each video and blog. This episode is called Easy and Rapid Diagnosis Cervical Neck Myotome Chart. So don't forget to download this. It's below the video or in the details section. This can simplify your life and practice. Without further ado, let's jump in.
I'm going to do a demo, and then I'll teach while the patient's cooking. And we'll also go back to the previous section. There's a few lingering slides that we need to go over. Can you bring my PowerPoint up, please, Jeff? So this session's about all musculoskeletal issues, cervical region and above. And we are going to come back to the trigeminal nerve, which requires not using a spinal point proper, but we'll get into that in a second. Okay, so let's practice diagnosis, right? So how does diagnosis work in this system? It's simple. We said that pain is a deficiency of voltage or electricity, right? So where's the pain? What neural level? And that becomes our diagnosis. So if you look at this chart here, and let's say there's pain here on the shoulder, you know that this neural level C6 is deficient. Now, you also know that the DO channel flows upwards. So if you're using a higher voltage device, what we do is we modify this chart a little bit and we treat 1 or 2 vertebrae lower than our diagnosis. 2 vertebrae lower is really better because now the difference between a myotome, a dermatome, a sclerotome, and a visceral tome is only 1 to 3 or 1 to 2 vertebrae levels off. So why not use the DO channel with a higher voltage device to our advantage by selecting a vertebrae level 2 lower than our diagnosis? That's for higher voltage machine. For a lower voltage machine, it's different. For a lower voltage machine, let's say we diagnose C6, I'm going to show you that we want to create a bracket that covers 2 vertebrae above and 2 vertebrae below. And you need more needles, and you need Huatos instead of DO channel. And the results are better than a lot of things, but they're not quite as good as when you use a higher voltage device. And actually, I'm going to show you a bracket right now for a neck problem, and it's as if it's going to be lower voltage machines, although I didn't bring any lower voltage machines with me, but that's because I didn't have access to any. It's a long story, I won't tell you. But the needling brackets is what's important. So I'm going to demo like a 4 or more needle bracket intending to show you how to use the lower voltage machines because, and I may demo the lower voltage bracket again, but for the most part, I want to move, after I demo that, into higher voltage stuff. Okay. It'll make sense as we go along. So we have a patient here. Yes, please. And can we get the mic? You could stand here. Just going to go through diagnosis. Microphone, anybody? Microphone's coming. So thank you. Okay. Now, here's how I do it. I say, can you touch the pain or discomfort?
Upper chap, and my head's kind of tilting to the left. I slept wrong on it.
So now consult the myotome chart that you see up there for where she touched. Where did she touch? C6, right? So now C6 becomes our diagnosis. That's the neural level that's deficient. So now we know, since C6 is deficient, that becomes our diagnosis. And if we're going to use a higher voltage bracket, we select C8. And if we're doing a lower voltage bracket, which I'm about to demo, we do 2 vertebrae above and 2 vertebrae below. I'll show you that right now. Questions about diagnosis? It's simple, isn't it? And it's looking at the truth. if you believe me that a deficiency in electricity causes pain. But I don't think you should believe me. I think you should try this in your clinic and get super excited the first week when the results are there and you don't even have to struggle so much thinking about diagnosis.
Are you doing 2 above because it goes bidirectional?
Doing 2 above because we're trying to bracket the area.
Okay.
And lower voltage, we're not sure how much of that electricity is getting into the area. Does that make sense? Yeah. Where when we're doing higher voltage, we're leveraging the flow of the dew channel, okay, which enables us less needles.
When you, with the high voltage point of select, are you using 2 needles?
Yeah, I'll show you.
Okay.
But yeah, 1 needle for a bracket, and then you could do 2 brackets, for example, with 2 different needles. Yeah. And then that leaves 2 other needles for some of these other treatments I'm going to tell you about tomorrow, like the blood electric or autonomic nervous system balance. Actually, I'm going to probably show on her also. There's a couple ways. Now, we're going to get more into detail tomorrow on autonomic nervous system treatments, right? So I have 4 treatments that aren't spinal this weekend, but they're plug and play. If you think her immune system's screwed, then you choose 1 needle for the blood electric. If you think her autonomic nervous system's screwed, then you choose 1 needle for the autonomic nervous system with the brackets. It's easy. So there's a bunch of different ways to see if a patient is stuck in sympathetic dominance. And one is when humans are stuck in sympathetic dominance, they twist. So sphenoid pelvic imbalance, their ears are on crooked, their digestive sphincters are stuck open, they're not ready to heal. So take a look at her, look at the camera, and tell me, do you think this patient could benefit from an autonomic nervous system balance? I think so. She's a bit crooked, right? But also, I cheated a little bit because before we started, she told me her neck problem and then it's like tilted.
So what did you think? Feel free to place your comments or questions below. Now remember, I created this great downloadable resource. The link will be in the description area. Be sure to grab that. Now, I hope you enjoyed this episode. If you did, click the like button, and if you have any colleagues that would benefit from this information, feel free to share the link with them. And for further information regarding my classes, you can visit electroacupunctureinstitute.com. If you wish to attend my free training called Discover the Secret to Boosting Cellular Regeneration, Reversing Tough Disease and Restoring Lasting Health in your patients with the power of electricity, click the registration link near this video. I'll see you next time.